New York City Poison Control Center presents Unintentional Poisoning. Prevent, React.
Children have boundless curiosity. Even those as young as 6 months old will grab anything they can get their little hands on. Even the best parents can't protect them all the time. You know the first place they put everything? That's right, in their mouths. When kids eat or drink something that hurts them, we call it unintentional poisoning. Each year, more than 2 million cases of unintentional poisoning are reported in the United States. More than half of these involve children under the age of 5. Over 90% of these occur in the home. Most caused by ordinary things, such as cleaning products, medicines, pesticides, and plants. We know you want to make your home as safe as possible. That's one reason the Poison Control Center wants to help you, with free advice and treatment, 7 days a week, 24 hours a day. All calls are free and confidential. Translators are available. You can ask us questions about any poison inside or outside your home. You can call at any time. After your child's curiosity has led to an unintentional poisoning, or more importantly, before an unintentional poisoning happens. We want you to know how to protect your family through prevention. A few minutes with this video might save a life. How to prevent unintentional poisoning. Look around your home. What potential poisons are there? And are they out of the reach of children? Take something as innocent as baby powder. We all have used it. But did you know that if talcum powder is inhaled, it can cause lung injury or even death? Keep it out of reach and locked up. Some of the most potentially dangerous products are cleaners. Drain cleaner, oven cleaner, dishwashing detergent, and rust remover. Always keep them in their original containers. Ammonia, mixed with bleach, makes a gas that is dangerous to inhale. Use only one cleaning product at a time. Keep all cleaning products away from children. They can burn the eyes, skin, mouth, or even the stomach if swallowed. Be careful with oily products, like pine cleaners, lamp oils, and furniture polish. They contain petroleum distillates. If any of these products are swallowed, they can cause pneumonia-like symptoms that can be life-threatening. You know where to keep these. Out of reach. Pesticides are toxic. Think what they do to bugs. When children swallow or even absorb them through the skin, they too can experience breathing difficulties, violent seizures, or even death. Protect your children by keeping pesticides out of reach. Plants. They are beautiful and add a wonderful feeling to any home. Just be careful which plants you choose to put there. Some, like philodendrons, can cause serious pain and swelling if they come in contact with the mouth or eyes. Whenever you keep plants in your home, check with your local flower shop, garden center, or poison control center to see which plants are poisonous. Unless you're sure they are safe, it's best to keep all plants out of reach. As children get older and have access to more of the home, they're often attracted to what we call the pretty poisons. For example, perfume and cologne. If your little one drinks some, the results Could be anything from drunkenness to even coma. Hide them away and lock them up. Another pretty poison is any kind of medicine that looks like candy. Never call medicine candy. You may have seen some candy that doesn't even look like candy. Until children are old enough to realize the difference, it's probably a good idea to avoid them altogether. Novelty items like these can add to confusion in young minds. Of course, we need to talk about real medicines. They are a fact of life. There are a few ways that children can be unintentionally poisoned by medicine. One is by taking someone else's medicine. Another is by being given too much of their own medicine. You can avoid the risk of having your child get into someone else's medicine by keeping all medicines away from them. While child-resistant caps are important, they are not childproof. Medicines, like all potential poisons, need to be kept out of reach and locked up. A child unintentionally poisoned from medicine may be nauseous or sleepy or even hyperactive. You can avoid the risk of giving too much medicine to your child by using a medicine spoon or medicine dropper specially designed for children. You can buy child medicine spoons and droppers at your local pharmacy. You can get cabinet locks there too. They're inexpensive, easy to use, and they can prevent tragedy. There's one more potential poison in your home that you should know about. It's an odorless, colorless gas, carbon monoxide. You can't see it or smell it. It's produced from the incomplete burning of fuel, such as with a dirty chimney, a faulty heater, a grill, or any kind of engine running in an enclosed space. Unintentional poisoning from carbon monoxide can be deadly. Some people may not even know that they've been poisoned. They may just think that they have the flu, headache, nausea, dizziness, and fatigue. Odorless, colorless, and deadly. I know it may sound scary, but it doesn't need to be. There are many easy ways you can prevent carbon monoxide poisoning. Have your heating system checked every year. Buy carbon monoxide detectors. They're inexpensive and reliable. Install them in bedroom areas and just follow the directions for proper use. If your carbon monoxide detector goes off, take these steps. Open all windows possible. Call your local fire department. Call your poison control center. And, as in any gas-related situation, when in doubt, get out. Let's review what we've learned. To prevent an unintentional poisoning, keep all potential poisons out of reach in locked cabinets. Keep products in their original containers and never mix them. Keep potentially poisonous plants up high and out of reach. Install carbon monoxide detectors in sleeping areas. Use child-resistant caps on all medicine. Never refer to it as candy. And keep it out of reach of children. Most importantly, remember, most poisonings happen when ordinary household products are being used. So don't let a ringing phone or doorbell distract you and lead to tragedy. Be sure to put all dangerous products out of reach when you're not using them, even if you intend to go back to using them later. And oh yes, keep the Poison Control Center number on all your telephones. We know about children and their curiosity. We can help you prevent them from being unintentionally poisoned. How to react to an unintentional poisoning. With so many possible dangers in your home, we know it's easy to feel nervous. If an unintentional poisoning occurs, you might even feel panic. Don't. Stop and focus. It's important that you can act quickly and calmly. You're going to need to assure those around you, especially little ones, that the situation is under control. Reacting to an unintentional poisoning is like reacting in any first aid situation. First, tend to the child, then call for help. If the child is unconscious, call 911. If the child is having seizures or having trouble breathing, call 911 right away. Most unintentional poisonings are not that serious. Most are manageable at home and involve children who have come in contact with a small amount of a poisonous substance. At times like these, tending to the child means removing or reducing the child's exposure to the poison. For example, if poison gets in an eye, immediately flush the eye with water, not hot water, lukewarm water. Keep the eye about 2 or 3 inches away from the flow, and ask the child to blink as much as possible. Of course, be careful not to contaminate the other eye. After you have flushed the eye with warm water for 5 minutes, call your poison control center. If poison gets on the skin, quickly remove contaminated clothing. Wash the skin gently with mild soap and water. Rinse for 5 minutes. And call the Poison Control Center. If poison is inhaled, immediately get the victim to fresh air. And call your Poison Control Center. For any poison that is swallowed, gently remove any remaining substance from the mouth. For liquids, rinse the mouth gently. Then, call the Poison Control Center. If you can, have the poison container in hand while you talk to them. And be ready with this information: your name, the phone number you're calling from, the name, age, and weight of the child, the name of the product or substance involved, the amount ingested and when ingested, and the child's symptoms. The Poison Control Center specialist will advise you to handle the situation in one of 3 ways: tending to the child at home, taking the child to a doctor, taking the child to a hospital. Let's review what we've learned. Do not panic. For poisons in the eye, flush the eye with lukewarm water for 5 minutes. For poisons swallowed, gently remove any remaining substance or liquid from the mouth. If the victim is unresponsive or having trouble breathing, call 911 right away for an ambulance. And keep our number on all your telephones. We can help you keep your family safe at home. If you would like a copy of this video, or if you would like free brochures or telephone stickers, or information about preventing or reacting to unintentional poisoning, contact the New York City Poison Control Center. Certified pharmacists and nurses are available 24 hours a day, 7 days a week, even weekends and holidays. Every call is free and confidential. Translators are available. Call us. We are your Poison Control Center.